Welcome, Dr. Cameron Aldridge, psychologist. And today we're talking about hypnosis. But we're going to be looking at hypnosis in rather interesting terms. What is the intersection between those of us who do hypnosis essentially exclusively and professionals from the other side of the fence, the psychiatric, psychological professions, psychotherapists? Is there any merge? Can hypnosis be integrated with these things? Is there a chance to bring this all together at last?
Yeah, I think that's exactly what is so exciting, is that there is fantastic scientific and empirical research that are done at some fantastic universities like Stanford, Baylor, University of Washington. They're producing really impressive research results that I think is starting to get the attention of mental health professionals and licensed healthcare professionals that can start to integrate it into their healing practices.
So it's really coming from your end.
Right, yeah, it's usually backwards, right? But
right.
Yeah, it's nice that that research base is getting built nicely. One that most of us here are already familiar with, but
right.
Now the science is catching up to what we already practice.
Then you must be working with large numbers in order to have the right validity with it, significant
exactly,
statistical significance. So is there any particular aspect of it that you're finding most interesting? Are you hearing resistance for the two coming together, or is there some sort of awakening on your side that is, we're applauding on our side of the fence for sure. We need you.
Oh yeah, no, I think there is, there's always some skepticism around it just because of the baggage that hypnosis seems to carry with it through the decades, but
barking like, trees, quacking like ducks. Yeah,
yes. Yeah. And so when we can move past those ideas, then I think folks are interested in things that work, like a more pragmatic approach. And so when we're demonstrating that hypnosis not only helps people, but can do it very efficiently, and they feel empowered during the process, then that raises eyebrows for people. And for example, there's a fantastic quote in an article that was published by Dr. David Spiegel out of Stanford, and it says, essentially, based on all the outcome research that we have with hypnosis and how well we know that it helps, it says, if hypnosis were a drug, it would be the standard of care.
Oh, it's wonderful.
Yeah.
That's wonderful. And I concur completely coming from my side of the fence. Insofar as I think for burns, serious burns, hypnosis should be the go-to because we can absolutely stop bradykinin release. If we can get to the person with hypnosis within 1 to 2 hours. Dabney Ewan documented this beautifully in Louisiana. And I'd heard about this for years. And I've told people before, and here's the short version. I took a tray of spare ribs out of the oven at our cabin that was being toasted at 450 degrees Fahrenheit. And it was a heavy tray, so there was a lot of heat held in the metal tray. I had the requisite blacksmith gloves on, of course. Set it on the counter, took the gloves off, and it wasn't quite on the counter. And not thinking, I now grab it 5 seconds later with my bare hand, and the fingertips stuck to it. It was so hot. I don't think I left flesh behind, but it stuck to it. And I said to my wife, I was running it under cold water first. I said, I'll be back. I'm going to test something. So I went in the other room for maybe 15, 20 minutes max, put myself in a trance, and imagined a tiny little fireman with liquid nitrogen spraying it abundantly on these 2 sore fingertips. One at a time, it would stop throbbing, he'd go to the next. By the time he got to this one would start throbbing again. Back and forth, about 10, 12 minutes total. It stopped hurting. And so the next morning I got up and I said to my wife, look at this. Remember where I burned myself? She went, yes, you idiot. And I said, look, nothing. She said, it's the other hand. I said, it isn't. And Chris Thompson will tell you, I actually did it again the following year. Talk about learning, single trial learning, not applying in my case.
Right.
But when we can get that kind of measurable results, some people would just say to me, yeah, but that's just anecdotal. But my response is essentially the same. It's not large numbers. But something being anecdotal doesn't mean it isn't accurate or didn't work.
Sure.
Some people sort of use that as a dismissive cover phrase. So I don't have to listen to it at all. It wasn't 20,000 people being tested. But it's intriguing because if we know that there can be these profound effects, why do you think it's taken so long since Braid in 1885 to get to this point?
Right. That's what's such a mystery to me, and I think there could be a few factors going into it, but the fact that hypnosis has this wide use and that people use it in ways of entertainment, and it's gone through some issues in the past, especially with recovering false memories, things like that.
Right.
That sometimes it can take hits to its validity, but I really like the story that you shared too, because in at least the academic and experimental hypnosis world, pain management is arguably well, inarguably, the most researched application of hypnosis. We have the best research for pain management.
And wouldn't that be a wonderful thing to become widely accepted? So see, even medical doctors, the average GP would have maybe 2 days of hypnosis training too. So we could use that, or they could use that. When we think of it, whether one subscribes to the gate theory or not, whatever our approach is, we certainly know that by causing profound relaxation, which we can do quickly with hypnosis, then the brush endings of the nerves are going to move further apart. We're not going to get the same transmission of pain. Or we can reframe it, change the meaning. It's not throbbing agony anymore. It's that discomfort in the background. I mean, reframing can be incredibly powerful too. So I think that's amazing, because pain management, like burn management or helping burns heal, is a tremendous area that people can get immediate benefit, immediately feel better.
Oh yeah, especially with the opioid crisis still, that's a huge issue in society. And so hypnosis is a fantastic answer to that.
Right. I think it was Richard Bandler who said that our brains, the pharmacopoeia in our own heads, it'll produce more powerful chemicals than anything you can buy in a cannabis shop or at your local drugstore. Yeah. We're talking like, micro doses of things that are causing incredible shifts. And of course, we can cause shifts not just in the physical body, but in neurochemistry, purely through suggestion. What are the limits to this?
I mean, that's what we're trying to figure out.
Yeah. Yeah. Well, I'm glad somebody is.
Right. Yeah.
So how do you see it operating in the future? Do you just see it? I kind of look at it in terms of, it seems that hypnosis right now is at its biggest renaissance since the 1880s, when Bernheim and Liebo were teaching and Charcot was being an idiot, and Salpêtrière in Paris with these crazy ideas about hysteria. But back then it boomed so quickly, and now we're seeing the same thing. I'm convinced that 99% of all hypnotists who have ever lived are alive today.
I like that. No, I think that's it's encouraging too, and I think a lot of what we're seeing is similar in the professional field of licensed healthcare professionals, is that there is this acknowledgement of the powerful use of hypnosis. For example, the North American Society of Menopause, they now list hypnosis as a level 1 or recommended treatment for treating hot flashes.
Wow.
Because it works so well for
I wish you told me that 17 years ago, he says.
It would have made your life a little bit easier.
It would have made my life better for 7 years, yeah. 7 years of just absolute hell.
Yeah.
Sorry, I'm going back there, right? Regressing into it. But I find this is really encouraging, because to me, it makes me realize, Dr. Aldridge, that we're moving in parallel lines here, but that are gradually converging.
Yes.
And I think the number one thing is we both recognize the other side of the coin is not the enemy, trying to stop us doing things or that we're doing crazy stuff. It's the other side of the coin is just another aspect of the whole field of hypnosis, to which I must add whatever the heck that is. Because now we're not going to even be able to get a working definition of hypnosis that everybody will agree on.
Right.
In fact, there is no legal definition of hypnosis anywhere in the world. So how do we even know if we're doing it?
Yeah, that's our laboratory does a lot with the definition of what hypnosis is and the theory behind it. And the American Psychological Association has an official definition, but a lot of researchers still battle about it, even though it's been around for 10 years.
When the American Psychological Association did an event in Toronto a number of years ago, my friend Arthur Perlini is professor of psychology at Algoma University in Northern Ontario. He did the work with legendary Nick Spanos out of Ottawa. They're together working with polygraphs and all sorts of things, getting people to rescind what they'd said, and amazing. And he got me into the meeting, although I'm not a psychologist. It was very kind of him, through some degree of subterfuge, I imagine. But it was great, because one of the definitions that one of the speakers said I thought was really cool. He wanted it on a t-shirt. I don't know if he ever did it. Hypnosis. It's not what you think it is. It's what you think it is. And I thought, oh man, that is so classic hypnosis. There's always the paradox, always the double binds, and the language patterns. So what will we see over the next few years?
It's a great question. So one thing that we're excited about and our lab is really moving in the direction of is the renaissance of psychedelic assisted therapy, is, at least in the field of psychotherapy, is huge. And I think it's because it operates in a way that is similar to hypnosis. I see psychedelics as kind of like chemical hypnosis.
Oh, that's really interesting. I've never heard that. That's fantastic.
That's Dr. Aldridge's personal opinion, but I really do see, psychedelics are like chemical hypnosis. They really guide people into a similar non-ordinary state of consciousness that allows them to experience very profound and life-changing experiences. And so we mirror that same thing with hypnosis. And so sometimes people require a psychedelic or that's more accessible to them, however it is. So in our lab right now, we are using hypnosis to facilitate a mystical experience or like a psychedelic experience. And so we're actually using the exact same measures that they do in psychedelic research. And it's all the same. The only difference is we have no plant medicines involved, no psychedelics involved, just the hypnosis.
That's what I like. That's great. Yeah. And getting the same results with
Exactly,
hypnosis.
the same profound experience. Like we've done a couple pilot studies and people are having these profound life-changing experiences in this 1.5-hour procedure that we made up essentially. And
it's all made up.
Exactly right. And we're seeing that as we track them, that they're experiencing benefits and their flourishing improves. And where we really see this being helpful is one of the biggest problems in psychedelic research is there are no good control groups. Because if you try to give somebody a placebo telling them it's a psychedelic, they're going to know within about 5 minutes that, oh, I didn't actually get a psychedelic because nothing's happening. So what we can do essentially is we're providing the control group now for these psychedelic studies because we can have them experience things to the same degree and salience as a psychedelic, but with absolutely no substances.
Now, this is wonderful because this is the obverse. If we go back through the checkered history of chemicals and human beings and hypnosis with people like George Estabrook and Martin Orne at University of Pennsylvania would put together MK Ultra. And of course, maybe the most reprehensible of all was you and Cameron out of Montreal, Canada, when they were giving LSD to people without their knowledge and massive doses using insulin shock and electroconvulsive therapy and keeping people in comas. I mean, this was essentially torture and dehumanizing these people. And I think when we hear the psychedelics being involved in in the studies, then the concern is, oh no, is it that again? But clearly, when you're talking about using entirely the hypnotic, getting the hypnotic effect instead of actual plant-based psychedelics, that is absolutely the opposite of it. I think it undoes the other work.
Yeah, I 100% agree. Yeah.
Amazing. Well, let's keep watching and let's see if your side and my side can converge and be on the same side.
I would love that. Yes.
Me too.
And people can find me and my content on social media. My handle is at Cameron Aldridge. That's on TikTok, Instagram, YouTube, and we'll throw it up on the screen down in the comments. So you can find me there.
Thanks again.
Yep, thank you.
And good night.